Hello and welcome. Homeopathic tissue salts, also known as Schussler's biochemic tissue salts. It is a system of 12 inorganic mineral compounds developed homeopathically to support the cellular health. The system was developed by Dr. William Schussler in 19th century. And the theory suggests that any ailment stems from the imbalance of these mineral salts at cellular level and can be corrected with the microdoses of these mineral salts. Means the system was developed to make up for the deficiencies of lacking mineral salts in that particular tissue. And the background of this theory is essential inorganic salts are necessary for the maintenance of homeostasis in the living tissue, means the functionality and structural integrity of the cell. And the preservation of a proportionate relationship between the components of the cell is what controls the homeostasis. Means the different components of the cells work together by maintaining harmony with each other. That is what is called homeostasis. And the proper balance of these mineral salts is very important for the maintenance of this homeostasis. The symptoms materialize due to the breakdown of this homeostasis, and the disturbed homeostasis can be corrected with the microdoses of these salts by giving in potentized form. Maintaining a normal balance of these essential mineral salts can be achieved by providing lacking mineral salt in uncomplicated and absorbable form. And the homeopathically produced microdoses is the most efficient way to digest these salts because they quickly enter the circulation and into the cell. So the main function of the mineral salts or tissue salts is that to preserve the homeostasis and to maintain the structural and functional integrity of the cell. It works at the tissue level, at the cellular level. In clinical practice, the role of tissue salts is very significant, especially in pathological cases, where merely treating the symptoms or totality of symptoms is not enough. Means silencing the symptoms is not enough. But along with the symptom totality, addressing the local changes, the structural and functional changes happening at cellular level is also very important. So when we treat the patient at both levels, at general level by considering the totality of symptoms and at local level by considering the structural and functional changes happening at cellular level, the chances of recovery will be more. So when we prescribe a tissue salt along with the main remedy chosen on the basis of totality of symptoms, the chances of recovery will be more. It indeed complements the process of recovery. It enhances that process, hastens that process of recovery by reversing the structural and functional changes happening at cellular level, at tissue level. And also in geriatric cases where we see the degenerative changes happening at cellular level. In cancer cases, to alleviate the symptoms of side effects of chemotherapy and radiation. And also in palliative care, in incurable diseases to improve the quality of life of the patient and end of life outcomes. The role of tissue salt is very significant. And in pregnancy, during pregnancy, it acts as a complementary support by supporting the emotional and physical well-being of the mother, and also fetal development by increasing nutrient absorption and by reducing the general discomfort during pregnancy, like early morning sickness, nausea, fatigue, cramps, or stretch marks without any side effects. And also play an important role during the early childhood phases in cases of delayed milestones, delayed dentition, delayed walking, in cases of anemia, when the child is not gaining enough weight, there is a lack of appetite. So it increases the nutrient absorption and improves the general health of the children. So this is the significance of tissue salts. It improves the general health by improving the cellular health directly.